Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide the COVID-19 update for Simcoe Muskoka. So I'd like to begin with my condolences. We've had 2 deaths since I last reported a week ago, both women in their 80s at Simcoe Manor. So I would like to express my regret to the family members for your loss. This brings us to a total of 9 individuals who've passed away at Simcoe Manor as part of their outbreak. And that takes us to a total of 49 people who've passed away in Simcoe Muskoka from COVID-19 to date. We have a total of 1,305 cases in Simcoe Muskoka. This is an increase of 126 since I last reported a week ago. At that point, the week before that, we had 100 cases, so we definitely have an increase over the preceding week. If we look over the weekend and include yesterday, we have a total of 73 cases, 54 on the weekend and 19 yesterday. If we look at the latest 19 cases, 18 of them are sporadic. 1 of them is a workplace-related case, part of a workplace outbreak. 5 are males, 11 are females. They range in ages from under 10 to in their 60s. All of them are in Simcoe County. 2 of them are community acquired. 4 of them are close contacts of cases. 12 are under investigation, and 1 is part of a workplace outbreak. All of them are at home self-isolation. If we look at all of our cases to date, 1,089 of them have recovered, and 161 are active cases. 5 of our cases are presently hospitalized, 1 of them in the intensive care unit at RVH, 2 of them at South Lake, and 1 of them at Georgian Bay General Hospital, and 1 of them out of district at Headwaters Hospital in Orangeville. This is also an individual who lives in our area but is at that hospital. We currently have, sorry, I think I can hear somebody typing. Just a reminder, if you could mute your line, please, that'd be helpful. Thank you. We currently have 5 outbreaks. 2 of them are in long-term care facilities, 1 of them in a congregate setting, a group home, and 2 of them in workplaces, and I'll be getting into more detail about them later on. And over the past week, we've had 2 outbreaks declared over. 1 of them was a manufacturing and construction site workplace as part of an outbreak, and there were a total of 4 staff members who were cases, 1 of whom lives out of district, so not included in our case count. So that is over. And the outbreak at Roberta Place in Barrie is also over. It was declared on October the 26th. However, it turned out that what we had was a single staff member who had a positive test, and then when we reviewed and followed up further, found that they had either a false positive or what we call a remote positive test, one indicating that they'd been infected in the past but were no longer infectious now, and so on that basis, we declared the outbreak over. In terms of our schools, where we've had a total of 36 individuals as cases who had been at school, affecting 28 schools, elementary and secondary schools, but no school outbreaks, no transmission in any schools. If we look at our dashboard, last week I'd indicated that we were in a yellow status. We remain in yellow status. Just to give you a sense, we range from a possibility of green, yellow, and red. And there are 4 categories of data or indicators that inform the overall yellow status. And One of those is viral spread and containment. That remains at yellow. This is because of the case counts that we've had, the incidence of cases, which has gone up a little bit from last week. In terms of laboratory testing, we're at a yellow status. We've had a slight improvement in the 48-hour. The percent of our tests that come back within 48 hours, that's now 74% versus last week it was 60%. So that's moving in the right direction. But our goal as an indicator is 80% or more. In terms of our health system capacity, we have a yellow status, and this is because the occupancy of our acute care beds remains high at 84.3%, although that's slightly less than last week at 86.3%. This occupancy is unrelated to COVID-19. It's just high utilization of healthcare for all reasons that the healthcare system is utilized. And in terms of the public health capacity, we have ourselves down as red, and this is because of a reduction in the percent of our cases that we're able to reach within 24 hours, the target being 90% or more, and in fact we're able to reach 72.8%. And also to follow up with our contacts as well, our high-risk contacts. So that remains as a red status. We, as I noted, overall have a yellow status for the entire dashboard. If we look at our trajectory of cases, as I'd indicated, our case count for the week is up compared with last week, and so the incidence is also up at 18.7 cases per 100,000 population per week. Last week it was 16 per 100,000 population per week. What I would note is that 2 weeks ago it had been higher, still at 22.5%. So 2 weeks ago we were up to 22.5%, we went down to 16%, and we've come back up to 18.7%. Or not percent, cases per 100,000 per week. We are less than half of the provincial incidence of cases. The province right now is 41.4 cases per 100,000 population. As I said, this week we here in Simcoe, Muskoka are 18.7. We continue with an elevated reproduction number at 1.2. So anything above 1 means that the pandemic is growing here, and that would certainly be in keeping with the increased case count this week as opposed to last week. And another way of looking at things is our doubling time. If we continue on at this present rate of growth, how long would it take before we have twice as many cases as we have now? And our figure for that is 2 months. So by the time you got to just before Christmas, December 23rd, we would have around 2,500 cases here if we continue at this rate of growth. In terms of our outbreaks, so we have 2 long-term care facility outbreaks at present. One, Simcoe Manor. We're continuing with 23 confirmed cases among staff and 14 confirmed cases among residents. So this is unchanged. What has changed is an increase in the number of deaths. As I'd indicated before, we have 2 additional deaths, making a total of 9 deaths. Everybody at that facility has been tested, and there's excellent support for managing the outbreak. We have Simcoe County as the operator providing additional resources, recruiting additional staff to ensure sufficiency of care, bringing in enhanced sanitation and cleaning, and with some resources from Stevenson Memorial Hospital and very much from RVH with management and direction from RVH, and the provision of physician resources and infection prevention and control guidance. And as as a health unit, we are, of course, participating as well in the response to this outbreak. We also continue with the outbreak at Bradford Valley. It's unchanged with 2 positive staff members. It was declared on October the 7th. We're continuing to monitor that situation. In terms of other settings with outbreaks, I'd mentioned a group home. This is a home in Simcoe County. Their outbreak was declared on the 17th of October. They have a total of 5 staff members who are cases. This is up from 2 staff members when I reported last. All of the staff have been tested. Those affected are, of course, in isolation. And we're monitoring the residents very closely. We haven't been able to test them because of their condition is such that it would be very difficult to test them. And so we're instead monitoring for symptoms, and if any of them develop symptoms or signs of COVID-19, they would be regarded as cases and managed as such, but as yet we've had none identified as such. We have 2 active outbreaks going on in other workplace settings. So one is a food processing plant in Simcoe County, declared on October the 5th. A total of 24 confirmed staff who are cases, and this is unchanged from when I last reported. Everybody at the premises has been tested. All those that are considered to be contacts or cases have been in isolation. And the other outbreak that we have is a manufacturing facility in Simcoe County. It was declared on October the 21st, and they have a total of 23 cases among their staff, which is up from 3 cases that they had when I reported a week ago. So very much, it has very much grown since I last spoke. We've actually got that facility presently closed, and everybody at the facility has been tested, and otherwise managing it closely to bring it under control. Okay, with regards to some key points that I would like to make. First off, if we look at the pattern of cases that we see and the transmission pattern that we see, one of the things that I've noted before is that we have clusters in households, very much in Barrie. We've had a total of 17 of these. At present, we've got 3 of them that are new. They involve some of them families, and some of them aren't families, but in fact are groupings of other people, young people, either working or students or both. And once it gets into those premises, it can affect a large number of people. There can be large numbers of people in those households, and that's been one of the things that's been very much a part of the pattern of the outbreak as we see it right now. There's workplace exposures that are related to these households as well. A number of these individuals work in different settings. We also note that there's a pattern of exposures among healthcare providers who haven't been wearing their full PPE. And the lack of the visor might be an issue in some instances, and this can involve a broader range of allied health professionals, including physiotherapists or massage therapists or chiropractors and other health professionals as well. So this would be a cautionary note, and we do intend to put out more communication targeted to healthcare professionals about the importance of wearing your full personal protective equipment. Those who provide personal health personal services as well, such as hair cutting and such, it's really important that they wear a mask, wear a visor, protect yourself, because the nature of your work can put you at risk. You're in close contact with many, many people. And the other thing we're noting about work environments is that people might be wearing their face coverings while they're on the job, and then letting down their guard and not wearing it when they're socializing with people from work, or if they're in the lunchroom together away from the public. It's really important that you have your physical distancing from other employees. If you're in that situation and you're not wearing your mask, of course, if you're eating lunch, you have to take off your mask. So the physical distancing is important. Or if you're just on a break, you've got to keep the mask on, particularly if you are within 2 meters of each other. Another thing would be if you're in a vehicle going to work together, that you need to be spaced from each other, with somebody in the back seat, the other in the front, window open, and wearing a face covering. If you're not from the same household, you need to be doing that kind of thing. Just a reminder that people need to stick to your own household and not have a larger social circle of people that you're in direct physical contact with. Otherwise, you need to be maintaining your physical distancing from people, wearing face coverings if you're in an indoor setting, public setting, or are unable to physically distance outdoors, and doing hand sanitization, self-monitoring, and self-isolation if you develop any symptoms, and seeking testing, seeking assessment. So that was very much a part of my messaging going into Thanksgiving. This is the year of the pandemic, and a very unusual time for us. And the usual gatherings that we do together at festive times cannot happen. It cannot happen safely, and you really need to be restricting yourself to your household, and otherwise engaging with people from a distance, with remote communication, or outdoors with distancing. And so we have noticed this increase in our cases over the last week compared to the week before, and 2 weeks ago we had Thanksgiving. So I had some analysis done to see what the potential contribution of Thanksgiving gatherings had been on our case count, and they are as follows. So the week before Thanksgiving, we had up to 1,006 cases, and after Thanksgiving we had an additional 281 cases. So since Thanksgiving we've had 281 cases, and from our history taking, 43 of those are attributable to Thanksgiving gatherings. We've had a total of 21 gatherings of that nature. And that has led to 43 cases. So about 15% of our cases since Thanksgiving are related to Thanksgiving gatherings. And what we find is that there's a full range of ages affected by this. So while it's primarily young and middle-aged adults who are affected, we also have those who are children and those who are seniors affected, and those who are seniors are the ones that are put at the greatest risk, of course, of developing complications. I think this is a really important point for people to note, because we do have other occasions coming up in the future, and we're going to have to be careful again when it comes to avoiding transmission through such gatherings. I want people to take to heart at this time. We want people to stick to your household. I know that's very hard. I know it's completely contrary to what would feel natural to us all, including myself. But the alternative is this kind of transmission, I'm afraid. I would like to offer my congratulations to Coaching Ontario Health Team, who were given a Bright Lights Award by the Association of Family Health Teams under the category of the social determinants of health for their community-wide COVID response strategy, which took into account the social determinants of health. And it's most noteworthy that through their collaborative work, their response strategy, and with their partners, they were able to achieve 0 cases of COVID-19 in congregate living settings in Couchiching area. So congratulations to you. I'd like to bring to people's attention that we are conducting a survey that people can access and participate on our website, seeking to understand the impact that COVID-19 has had on your life, the hardship that it may have created for you, your perceptions of it, your perceptions of our response to it. So please feel free to participate in this. We're looking for a full range of respondents, of those above 18 from our district. And we hope that this would give us good information to help us in our own response or help us with advocacy that we might provide or advice that we might provide to other agencies for a more successful response to COVID-19. Just kind of, I guess, a reminder to people and to employers about the target groups for COVID-19 testing. So the province has put out, and I very much support, that assessment centers are to be doing testing for people who have symptoms of COVID-19 or who have been a contact of a known case of COVID-19. There are other reasons as well, such as travel out of country or people who work in long-term care facilities, people are visiting long-term care facilities. But other than that, the province is not advising that people get tested. And what we are seeing is that there's some employers that are requiring their employees to get tested as a condition of returning to work. And it might be a situation where, say, they have a child who has some symptoms of COVID-19. And we would note that symptoms alone wouldn't be an indication for that for the child. Like, the child should get tested, but the family members do not need to be tested under those conditions. So we would just want employers to be aware of that, people to be aware of that in general. Okay, we do note that we've had some ski resorts asking about the guidelines for their operations, and so we put out a letter to them advising how they can approach operating that's in a safe way. So if people are interested in that, please have a look. We posted it up on our website. We also note that there is some travel people from other municipalities that are to the south of us that are in a modified stage 2, where they've got restrictions on fitness centers and other venues, that they're now tending to use those centers in Simcoe County, and particularly in the south of Simcoe County. And I'm aware of at least one of our local municipalities that's put restrictions on that. I would say that I support them in that. It's important that people not travel for that kind of intent or purpose. The province has advised people, in particular around Easter, they were in Easter, but also in particular around Thanksgiving, not to travel for that purpose. I'd just like to reiterate, it's important that people stay close to home. We are launching a communication campaign for young adults with regards to COVID-19. We noted that in September, the rise in cases was very much related to young adults, whether it's through social interaction or through work. And that continues to some degree in October, although we're now also seeing seniors affected through outbreaks in long-term care facilities. So we do wish to reach successfully young people with our messaging. So I've got some media questions, and a couple of these were posed to me from Innisfil. So specifically with regards to Innisfil. Innisfil recently had its first COVID-19 death, which was troubling for all of us to see. Can you paint us a picture of cases in our community and across Simcoe County right now? So I would say that we're very much in our second wave, that we've very much seen a rise of cases. The total number of cases week on week is twice as high as it was in the first wave, although this in part is due to more testing than we were doing in the first wave. That the age of people affected was younger in the early part of this wave compared with wave 1. But we are also seeing older people affected because of long-term care facility outbreaks. We are seeing more people in southern Simcoe affected than in northern Simcoe or Muskoka. And I think that the municipalities to the south of us need to be aware of that, or are in fact very much aware of that. We are seeing, in addition to one large long-term care facility outbreak, a number of employment settings, manufacturing and food processing, in which we've had a significant number of people affected that has required, in some instances, those facilities to temporarily shut down. And as I've said before, we've seen clusters of households, in particular in Barrie, that have been affected, where you have large numbers of people living in a single household, and once it gets into those households, many people can become cases. So that's what we're seeing, and I would say that Innisfil is typical of that overall pattern, being more in the south of Simcoe County. It's among those that have seen the most in the way of growth, and that it's primarily young people and often employment related. If we have another question, also from Innisfil. Halloween will be here soon, and you've got some guidelines for that. Can you give us a brief overview? So what I would say about Halloween is that, first off, it is entirely a suitable option for people not to participate in Halloween if they don't want to do so. It would be the safest option not to participate in Halloween. And this would go for those who are doing trick-or-treating as well as those that are providing candy. If you do decide to participate in Halloween, you need to do it in the safest way possible. That means sticking to immediate household members for going around the neighborhood, keeping your distance of 2 meters from other people. If you can wear a face covering, all the better, and that might fit in well with your mask. People at the door could choose to wear a face covering, but keeping the 2 meters is important. Finding ways of distributing the candy that would allow you to keep the 2 meters would be important as well. Hand hygiene and hand washing would be important, certainly while handling the candy. That's one thing you could do, is opening the wrappers and then washing your hands. And don't go out if you're unwell. If you have any symptoms at all, you need to be self-isolating and seeking assessment. And that would be it pretty well. As I'd said, it's certainly a perfectly valid thing not to participate in Halloween if you want the safest option. And also, it's important not to do alternatives that would be a higher risk, like Halloween parties would be a higher risk thing to be doing, and therefore would be contrary to provincial advice, provincial requirements for indoor gatherings, for example. So you can always come up with alternatives that involve distance communication with other people outside of your household, or events in your household just for your household members. With winter coming, marks the beginning of the flu season, at a time when people need to get a flu shot. Why is it even more important to get it this year? So indeed, influenza is an important disease, and it's important that people get the flu vaccine each year. And this year would be all the more so because, for one, you would not want to get both influenza and COVID-19 at the same time. That would be a very bad combination. And for another, you wouldn't want any confusion about possibly having COVID-19 because, in fact, you've got influenza. So this is something you have control over. Getting the vaccine is a way of avoiding this problem, and so I very, very highly recommend it. Pharmacies have the vaccine. Family physicians now have the vaccine, and there'll be more vaccine coming into November to enable them to provide it to their patients. During the spring, at peak, we had 10 or 9 patients hospitalized with COVID-19 for the first For the second wave, we had 4. Is it possible that the virus is less powerful than it was during the spring? So it is certainly true that so far we've had far less mortality, though we definitely have had mortality with the second wave. We've had less hospitalization from COVID-19 than we had with the first wave. I think time will tell. There are a few things going on here. One is that we've had a younger demographic of people affected by this outbreak, this wave, compared with the first wave. The first wave, there was many more long-term care facilities and retirement homes that were affected, and that may yet happen. We've had some so far. We have one that's very large, Simcoe Manor, but we may get more, and we need to do all that we can to avoid that from happening. The other thing is that in wave 1, it's possible that we actually had many more people who are cases in wave 1 compared with wave 2. We had far less of an ability to test people in wave 1, and so we were probably missing many more cases than we are right now in wave 2. And if you have a lot more people that are affected, then you have many more people that can become seriously ill and end up in hospital. We shall see how things go. We have in place more control measures, people using face coverings, and hopefully much better hand sanitization and better monitoring, better ability to get tested, better controls in the healthcare environment. Early in wave 1, we didn't have universal personal protective equipment up as a standard precaution in healthcare and in long-term care, and now we do. We have a lot more in the way of screening as well. Screening in the work environment, face coverings required in the work environment. So if we're fortunate, we will continue to have a less severe experience with wave 2 than wave 1, but it really comes back to our collective action to achieve that. Do we know if asymptomatic people are as contagious as symptomatic people, and if there's a difference between the two, do we know at what point the asymptomatics are contagious? So people are most contagious with COVID-19 as they're emerging with their symptoms. So 48 hours before they develop their symptoms, they can be contagious, and there's some people who never develop symptoms and are asymptomatic cases. And it is certainly possible for people to transmit COVID-19 even when you're asymptomatic. As I said, you're most likely to do it early in the infection, early when you develop your symptoms or just before you develop your symptoms. There have been instances where people who have had no symptoms have been the source of large-scale outbreaks, super spreader events. So that certainly is cause for concern, and that would be a reason for all of the control measures that we have in place. That's a reason why you need to maintain physical distance from those outside of your household, and to wear a face covering and use hand sanitization. It's also a reason to be really, really good about self-screening and monitoring, and if you develop any symptoms, to not go to work. We've had a number of instances where people early in their symptoms, when they feel they don't have much going on, have in fact gone to work and exposed people. Fortunately, the majority of time, probably because of the other control measures, there haven't been transmissions happening in those cases. But it's really important that people know that early on is when you have the least symptoms is when you're most contagious, and so you need to be very careful and err on the side of caution even with the slightest of symptoms. So why was the Roberta Place long-term care facility up and then down from the outbreak page in a short period of time? And so, like I said, it was declared on October the 23rd, and over on the 26th, it was one staff person. They had a positive result, and then we followed up a retest that was negative, and we determined that they had either a false positive or they had a remote positive test, remote meaning that they'd been infected in the past but were no longer infectious. Either way, we determined that, and in fact, there was not an outbreak happening. So we declared it over. Why has there been a drop in testing? Is this a result of the provincial directive that only those with symptoms should get tested? Does that mean asymptomatics are being missed, and is this an issue? So I don't know why testing is down. I've gave some speculation on this last week. Indeed, it could be due to the province's criteria now that focus on those with symptoms and those who are contacts of a case and those who are part of an outbreak, and certain other reasons that I've touched on before. But I support those as criteria. I believe there's good evidence that if you test people who have no symptoms and no contact history, your yield is going to be very low, perhaps 1 out of 1,000 tests. And of those who are positive, there's a very high likelihood that they will be a false positive test. They're more likely to be a false positive than a true positive in those situations. So I don't think that opening it up to people who have don't have those indications, that, you know, to people who don't have symptoms and don't have a contact history with the case, I don't think it would be helpful. I don't think it would help us to identify those that are asymptomatic. The ability to find them through this means is just too weak. It's not an effective way to do so. If case counts continue to rise or remain high in Simcoe County, would the community return to stage 2? Would Muskoka be forced to return to stage 2 as well? And I would point out that Muskoka has quite a bit lower incidence than Simcoe County. Their last known case was October the 21st. There is a difference, indeed, in the incidence of cases in northern Simcoe and in Muskoka versus south Simcoe. Ultimately, if cases keep rising, there may very well be a decision from the province to apply more restrictions in Simcoe. It may be Simcoe, Muskoka. We've not seen the province target a response within a health unit. It's been an entire health unit. So if they were to do it differently, that would be a change for them. Now, we're learning very much as we go with this pandemic, and the province certainly is learning as well, because this is a new disease, and changing their approach over time. So it's possible, it's possible that they could apply such restrictions in Simcoe County without Muskoka. We will see. You know, we've had a bit of a plateau over the past 2 weeks. We had a higher case count 2 weeks ago than we did, or 3 weeks ago than we did last week or this week. If we're very fortunate, it will remain plateaued and will not continue to go up. We can't rest on our laurels. It's certainly entirely possible that it will go up. And if it does, we would have to look at whether or not more control measures are needed. I think what's really key for us now is for all of us to apply these control measures that are in place here to the utmost, to control this, to flatten the curve, and to bring it back down again. So at this point, I'd be happy to take questions.
Okay, thank you, Dr. Gardner. Erica Engel from Collingwood today. Go ahead, please. Yes, thank you. I wanted to clarify one quick point when you were talking about service providers such as hairstylists. Did you say they should be wearing a visor and a mask?
It would be safer if they did. They would get more protection if they were to do so.
Okay. And I wanted to ask about hospital capacity. You mentioned there are 5 residents from the region hospitalized right now. Mm-hmm. It seems to be one of the factors the province is looking at closely when it comes to shutdowns and our ability to respond to COVID. How quickly can hospital capacity enter that red zone, and are you concerned for that?
Well, our hospitals are at a high occupancy right now, unrelated to COVID. It's just through standard healthcare that they're at that level. I think it would really be for them to determine how they would deal with a surge in COVID cases. We do know that RVH has its COVID response unit, and that gives them capacity to be able to deal with a surge of at least moderate size of COVID-19. So that's a resource for all of Simcoe, Muskoka. We're very fortunate to have that. At this point, we actually have a very low draw on our hospitals from COVID-19, and I certainly would become more concerned if that changes, if we start to see a great increase in the number of cases admitted to hospital.
Okay, sorry, just one more question if I may. Bradford and New Tecumseh, their incidence rate is sort of on par with York Region, which is in stage 2 restrictions. Is there any, are you concerned about that? Are you talking with those areas about implementing further restrictions, or?
I think that's a very good point, and indeed they are much more affected, and it's related to proximity, be related to people who live there but are employed to the south. At this point, we don't have any additional restrictions for them. I do know that New Tecumseh is putting in place restrictions on the use of their municipal facilities for people from out of area. At this point, we're otherwise monitoring. It would be difficult for me to put in place a restriction that is only for a portion of my territory. Not impossible, but it would be difficult.
Thank you, Erica. Marge Bruneman from Barrie Today. Go ahead, please.
Thanks so much. Dr. Gardner, can you tell me about your thoughts? You mentioned Field Hospital at RVH, and how would that work if there is a need to use it and for extra capacity? Do we have the manpower in place that would require?
I think that would be a better question addressed to RVH themselves as the operator of the premises. I know that they have their plans in place for its operation, but it would be better if it were addressed to them.
Okay, thanks. And when it's called a regional facility, I'm talking again about the field hospital, is there a specific catchment area that it would relate to?
They themselves, I've heard their senior administration speak of this as a resource for the region.
Thank you.
You're welcome.
Thank you, Marge. Chris Simon from the Barrie Advance. Go ahead, please.
Thank you very much. Mr. Gardner, I'd like to ask about, you had mentioned settings. Was an agricultural facility that had 20 positive, correct? There were two. There was a manufacturing that had replaced, that was closed.
Sorry, Chris, I'm not quite hearing you.
Oh, how about now?
That's better, thank you.
All right, sorry about that. You had mentioned two workplace settings, a manufacturing facility that had been closed with 23 cases, and was the other facility, it was an agricultural facility, and was that closed as well?
It had been. It actually reopened again on October the 19th.
And the other question I've got is just to pull you back to some comments you made about spread within healthcare professional settings, chiropractors, that type of thing. Do you have any suspicion as to why they're not wearing proper PPE? Is it lack of knowledge or information?
They should have access. It might be awareness. It might be practice fatigue. We intend to do outreach to reinforce the message, and we may learn through that outreach more about why, but we are seeing some instances where this has happened.
Thank you.
Okay. Thank you, Chris. Allison Brownlee from the Muskoka region. Do you have a question? Allison, are you on mute? Okay, let's go to Dawn Huddlestone at the Huntsville Doppler. I'll come back to Allison. Nothing for me today, thank you. Okay, thank you, Dawn. James Bowler from Coachco, go ahead, please.
Yes, thank you. So, Dr. Gardner, first I have a very broad question for you. You know, we're seeing a bit of a dip in numbers here today, but overall across the country, you know, the numbers are going up. So, in your sort of opinion of what's happening right now, are we coming back down from this second wave? Are we continuing it? You know, where are we going right now?
Well, I think it's too early to tell. It's still too short a period of time. It's still a slight rise compared with the week before, like last week versus the week before. We had a significant number of cases that were from the one large long-term care facility that that's stabilized. So if you take that out of the equation, we've still got some growth in cases in the community. So I think it's premature to say that we've peaked.
Okay, and I just want to revisit something you said to one of the other reporters just regarding shutting down specific areas. You know, we are sort of a mixed bag of municipalities here, which is a bit different from other communities. So if it comes to it, are you able to piecemeal off certain municipalities within the health unit to have them under a different stage?
I think in theory I would be. I've not encountered any of my colleagues doing that, but there's nothing specific to the law that would preclude that. I think it's a good question. At this point, I'm not considering it, but it is a good question.
Thank you.
Okay.
Okay, thank you, James. Allison Brownlee, are you there? All right, then. Let's go to Brandon Piper at Moose. Do you have a question, Brandon?
You know, nothing for me. I think my question was answered. Thanks, Dr. Gardner. Thanks, Kathy.
You're welcome.
Thank you very much. Mike Arcelides from CTV, do you have a question?
Absolutely. How are you, Doctor?
I'm okay. How are you?
Hanging in there. The biggest area of concern for you remains those gatherings and households, inviting other people in to have a nice little party and soiree. Is that accurate?
That is a major concern of mine, yes. There's that. I guess there's three elements. There's socializing, social gatherings. There's the vulnerability of some crowded housing that we've seen. Once it's in there, it spreads. And then there's transmission in the work environment.
What is your assessment right now of the virus right now in the community and how it's being received by the general population? Do you still think that folks are saying, you know what, they hear down south from Donald Trump, you're going to get it, you're going to get immune, you're going to be fine, don't worry about it, wear a mask when you want, if you don't worry about it, just keep distance. Do you think folks are getting a little desensitized from all the warnings and all the advisories right now?
I think there's a shift in mood. I think that it's hard for people to abide by a high alert for a long period of time, and this has been going on for months. So very, very hard for people to do that. What we're asking of people and sometimes demanding of people feels very abnormal or unnatural to people. really putting a limit on people's social lives and social engagement and family engagement, and that's hard for people to accommodate, and it's hard on people. And it seems to me that we're seeing some fatigue with that. We see it in the data with regards to the numbers of cases that are directly related to Thanksgiving gatherings of family members. It may very well be that some people feel the cost of the controls that we are asking is too high, and that they would prefer to take their chances, or perhaps some denial about the virus and what's happening, or the seriousness of it. There are certainly those that have competing views about its seriousness, or a denial of its seriousness. But I think on the whole, it's difficult for everybody to keep up all of these controls.
Can I ask you, the individual who's in hospital in ICU at RVH, underlying conditions, age range, any information you can provide with regard to this individual? Because as we've seen, the success rate hasn't been overwhelming when we have individuals with underlying health conditions enter the ICU thus far here in Simcoe, Muskoka.
So to protect privacy, I won't be giving more detailed information about that individual.
Even underlying conditions?
I actually would have to look at the detail of that case. I don't have that information on hand.
But this certainly is not a young person.
As I said, I would have to look at the details of the case.
Okay. I'll be awaiting
Thank you,
those.
Mike.
Well, thank you.
Okay, Brett Glover from Barrie 360. Do you have a question?
I do. Thank you very much. Good afternoon, Doctor. I'm just wondering what your thoughts. We're well into the school year now, and as you noted earlier, there's been no spread within any school setting in Simcoe or Muskoka, and I know everything's being done to maintain that, but are you, I guess, for lack of a better, pleasantly surprised by the lack of spread among students?
Well, we do know that it's less transmissible among children. And we put an awful lot of work collectively in reducing the risk, all the control measures that are in place in schools. And schools are environments that we can control to a greater degree than evidently work environments where we're seeing spread happen, and certainly people's social environments. So I'm happy about it. It's certainly a challenge for us, for the schools and for parents and students to manage when there's been an exposure, because then you have many people that are off in isolation. So that is very unfortunate, very challenging. But I am happy that there hasn't been transmission to date, and I'm not completely surprised because of all the effort that's gone into it, and because, in fact, children are a less vulnerable group than adults when it comes to COVID-19.
Thank you. And I understand that, you touched on laboratory testing in your opening remarks, but with testing rates down, case numbers up, could you remind folks what the Simcoe and Muskoka percent positivity rates are and how that information is used to, I guess, more or less gauge the pandemic locally?
Yeah, so 1.3%. Anything less than 3% is more desirable than if it were more than 3%. It is an indication of combination of how high the prevalence or the incidence, the spread of COVID-19 is versus the amount of testing that you're doing. And if you see the number rise, that indicates that you're not able to keep up with the testing versus the spread of the virus, that the virus is spreading and your testing is not increasing with it.
Perfect. Thank you very much for your time.
You're welcome.
Thank you, Brett. Allison Brownlee, are you here today? Okay. Is there anybody on the line I may have missed? Okay, well, I think that wraps it up for today. Thank you very much, everyone, for joining us, and we will see you again next week.
Goodbye, everybody.